Selamat siang. Welcome back to my no-name channel. I'm Bruce, and this is another Bali COVID-19 update for August 1st, 2021. Busy week. This is the next to last day of the PPKM level 4 restrictions, and we're going to see what happens tomorrow. And I'm going to talk about that at the end in the wrap-up. So stay tuned or skip over there, whatever you like to do. So, first thing, let's see what is the situation with the PPKM level 4 restrictions before we get into the numbers. So, we know that we've been in this restrictions for another week, and they end until on August 2nd. So there's been a little difference between what's happening on the national level and what's happening on the level of Bali. And what are the differences? Well, the governor has made a few concessions to business and community activities. So what are those? People's markets that sell non-daily necessities can operate at a maximum capacity of 50% until 1600, 4 o'clock, instead of 3 o'clock as noted in the central government circular. And street vendors, grocery stores, voucher agents, outlets, barber shops, laundry, hawkers, small workshops, vehicle washes, and others are allowed to open by implementing strict health protocols until 2100 hours or 9 o'clock. And allowances also apply to dine-in. So people have been whining about not being able to dine in. Well, so now you can dine in. The president stated a maximum of 20 minutes. The governor of Bali allows up to 30 minutes. So the implementation of eating, drinking activities in public places, food stalls, restaurants, cafes, street vendors, and hawker stalls, both in separate locations and those located in shopping malls and shopping centers, can be open for 25% capacity, and maximum time is 30 minutes. Operating hours until 9 o'clock. They could stay open until 8 o'clock before. The governor said, as a governor, I understand very well that the implementation of the level 4 PPKM policy is very burdensome and makes it difficult for the community to carry out their daily activities, so that it causes disruptions to the community's economy. The COVID-19 Delta that spreads very quickly through family and office clusters. And he continued that under any severe conditions, in the end, the health and safety of the people's souls are the main priority of the government policy. And so that was why he did what he did. Now, the 30 minutes in the restaurants. Well, I'm going to get to that. I've got a story about that, a segment about that. I'll get to that in a while. Let's take a look at the numbers first, which unfortunately aren't encouraging. So let's take a look at the numbers. Not particularly good. 37,284 new cases in all of Indonesia, 1,808 deaths. Now with the restrictions ending tomorrow, is the government going to extend them and say, well, our numbers are down? If we have 1,808 deaths, that doesn't seem down to me. But I'm not the president. And the testing yesterday in all of Indonesia, 150,200 tests with 24.8% positivity rate. So still really high. And what about vaccinations in Bali? Well, we've got the 3,068,729, 71% of the population. So that's the first dose. Second dose, 871,595, so 20% of the population. And yesterday, 29,119 doses were distributed. And what about our numbers? Okay, we're over 1,000 again, 1,280 new cases. Recoveries, 908. Deaths, 34. And active cases, we're up to 12,410. So our 7-day average now is 1,228. And The 7-day average for deaths, 32. So these numbers are not looking good. If the government is going to loosen restrictions even more based on these numbers, well, I don't know. What do you think? I can't see it happening, but I was out today talking to people in shops, and a lot of people think that the restrictions are going to be eased. Well, we'll just have to wait and see what President Jokowi has to say. Okay, so with the new cases, 1,277 are Indonesians and 3 are foreigners. Oh, we actually have some foreigners today. Okay, 1,060 of the 1,208 cases were local transmissions. 206 cases were from domestic travelers, and 14 from international travel. And by Regency, Denpasar 433, Badung 247, Buleleng 159, Tabanan 125, Gianyar 105, Jembrana 89, Bangli 47, Klungkung 45, Karangasem 20. Not good news again. We're consistently over 1,000 still in Bali. So, I don't know. The testing is going on, and I'm going to talk about that in a minute. But, yeah, things are not sunny yet. Well, actually even the weather is not that sunny today. It's kind of cloudy, very windy. Okay, so what about the virus itself? Well, according to the director of the Jikman Institute for Molecular Biology, Amin Subandrio, COVID-19 Delta Plus variant is in Indonesia. It's been in Indonesia, according to him, for 3 weeks. He said that the variant is more deadly than the Delta variant, and it was discovered in Jambi and Mamuju. The World Health Organization's chief scientist said the variant is potentially resistant to life-saving drugs. Okay, so we've got a Delta Plus in Indonesia. Do we have it here? I don't know. The symptoms: cough, diarrhea, fever, headache, skin rash, discoloration of fingers and toes, chest pain, shortness of breath, stomach pain, nausea, lack of appetite, loss of appetite. Member of the House of Representatives Commission 9, Intan Fauzi, urged the government to take early mitigation measures following the findings of the Delta Plus variant being in Indonesia. This is not good news for us. Something even worse than the Delta. The Delta is spreading all over as it is, and now we have a Delta Plus. Okay, this is the first I heard of the Delta Plus. And so one of the issues that's come up about the spread of the virus in Bali is, where is it coming from? Now, a lot of people like to blame people from Java, coming back originally from Idul Fitri, and now we've got Idul Adha. That happened, 2 weeks ago now? Is it 2 weeks already? So, this story. 40% of residents exposed to COVID-19 in Denpasar municipality have an outside KTP. That means that they are not residents of Denpasar. So Denpasar has continually had the highest number of cases, according to the government. 40% of the COVID cases in Denpasar are residents who hold ID cards from outside the capital. And considering that Denpasar is the center of economic activity and population in Bali, this is not really surprising. However, it does create a problem for the local government in carrying out centralized isolation. So the Denpasar city government is coordinating with the Bali provincial government to find a place for centralized isolation. There's 4 centralized isolation places in Denpasar with a capacity of 400 beds, but these are intended for residents, Denpasar ID holders. According to Dewa Gede Rai, the Denpasar City COVID-19 Task Force spokesperson, a centralized place is needed for those people who do not hold residence cards, especially because positive cases are dominated by family clusters. And many of these people are self-isolating at home, and thus the need for centralized isolation place to avoid these family clusters. The task force is looking into hotels and other places that can be used for isolation, and in the meantime, the Denpasar city government is providing 2 meals a day for those undergoing self-isolation. Good for the Denpasar city government. Okay. So last week, I said that we have an oxygen crisis in Bali. So this week, the government is addressing that. The governor in particular is addressing that. And this is Bali to start producing own oxygen supply next month, according to the governor. The governor says the situation with oxygen is improving because Bali's received hundreds of concentrators since the crisis became public knowledge. But the crisis apparently has got the governor thinking about how to deal with the situation internally, locally, so that Bali's not forced to rely on outside resources. And Bali's been relying on oxygen from Java, but because of the situation there, the supplies have been disrupted, delayed. So the governor announced plans for Bali to begin producing its own oxygen supply next month. So at a press conference this week, he said that the pandemic situation has taught us to start producing oxygen on our own and not be dependent on outside resources. The governor has instructed hospitals to start buying machines or generators. According to Ketut Swarjaya, the head of the Bali Health Agency, one generator cost about 5 billion rupiahs. Not cheap. So let's hope that this plan comes to fruition soon. And so what about hospitals? In previous videos, I've talked about hospitals being full, some hospitals being full. So this segment, Bali sees its deadliest pandemic month yet as hospitals start to fill up. So numbers continue to be 1,000 or so a day, and hospitals are beginning to fill up. But as the governor has commented, they are not maxed out. They're not all maxed out. According to Dr. Wayu, a doctor from Udayana University Hospital, all beds there were occupied this week. But he noted that some hospitals on the island still have room to handle patients. And while there are still hospitals that can receive COVID patients, it's not uncommon to hear of patients having to try several hospitals before finding one that has a bed available. And that's been foreigners as well as locals saying this, posting these stories on social media. In the Coconuts article that I'm using here, they cite the case of one Heru Lolono. Heru Lolono is a 66-year-old Gianyar resident and tried 3 hospitals to find a bed for his 72-year-old sibling who had tested positive for the coronavirus 2 weeks ago. First he went to Siloam, and then Udayana University, and was told in both places that there was no room. Then around 1 a.m. on July 18th, he was finally informed about a bed available in Sangla. And this situation has been repeated a number of times, and there's a website that you can use to go and take a look and see if there are beds available at hospitals before you go there. And if I can find the link, I will put it down here, or I'll put it up here. So, how bad is the situation? Well, according to Made Wirwan, who's behind the popular @blog doctor health account and is currently practicing at one of Bali's public hospitals, the situation has not improved despite what officials have been claiming in recent days. He said, "The condition right now has not improved even with the arrival of oxygen concentrators." He noted that he's unable to generalize for all hospitals in Bali, but for hospitals that he's familiar with, that's the situation. And according to Diki Budiman, the Indonesian epidemiologist at Australia's Griffith University, and I've mentioned him many times before, he cautions that the government needs to move carefully because current testing capacity shows that they cannot find the majority of infections. And I'm going to talk about the testing capacities and what the governor and government are doing later on. He says the current positivity rate is around 45%, and notes that Indonesians, including in Bali, when they are sick, treat by themselves. And I have to admit, I do the same thing. They will stay at home. That's around 80 to 85%, he said. So what we see in the hospitals is just the tip of the iceberg, he commented. He warned that the community cases cannot be prevented without appropriate measures, and he mentioned the situation in Java not too long ago, which he said was a result of poor testing, tracing, and active case finding. He said Bali should be ramping up its testing and tracing in order to reach the target of 5% positivity rate. So, at this point, the consensus of doctors and officials is that everyone needs to be vaccinated because science shows that vaccine weakens the severity of COVID-19. According to Dr. Wayu, on average, patients that are treated in our hospital have not been vaccinated, around 97% of them. So far, Bali has been in the forefront of vaccinations, with over 3 million receiving the first dose, and we're working on the second dose, and that's planned to be completed by September, next month, end of September. So that's good news for all of us. But it's important to remember that if you get vaccinated, you can still get sick. Your symptoms are going to be most likely more mild, and the chance of death is significantly reduced. And most people that have been vaccinated, thoroughly vaccinated, completely vaccinated, can self-isolate at home without needing to go to the hospital. So, what's the word here? Get vaccinated, wear a mask, social distance. And in vaccinations, in Bulang, in order to form group immunity and prevent COVID-19, the second dose vaccinations continue. And I was supposed to get my second dose vaccination yesterday, but it turned out that the place that it says on my paper, according to the social media site for the local government here, the Regency, didn't have it listed as one of the places. And so my wife checked with a local who's familiar with this, works for the government, and he said, no, it's going to be on the 3rd. And she said, my husband is supposed to be the 31st. No, he'd do it on the 3rd. So that's the second dose. So in order to establish herd immunity, the Bulang Regency government continues to run a vaccination program starting from the first dose to the second dose for teenagers to everybody. According to the coordinator for data and information of the Bulang COVID-19 Task Force, Ketut Swarmawan, as of Tuesday, Bulang had 80.3% vaccinated with the first dose and 10.62% with 2 doses. So we've got a long way to go with the second dose. And that was because a lot of us got vaccinated later. A lot later. Some people didn't get vaccinated until they found out that they were going to have trouble getting their KTP or their SIM or any government assistance, and so everybody went and got it. So we're going to be doing the second dose into September, late September. According to the coordinator, the second dose for health workers has been completed, and 90% of public officers and more than 14% of the elderly have received second doses. The second dose of AstraZeneca is being administered throughout Bulang sub-districts. And if you're here and watching this and you're about to get a second dose, you are supposed to be careful and maintain body condition with adequate rest. Don't stay up late, and don't forget to have breakfast. And bring a photocopy of your ID card and vaccine card. Okay, and good luck with your vaccinations. So what's the situation? What's President Jokowi going to do tomorrow? I don't know. According to this article, President Jokowi said the lockdown doesn't guarantee COVID-19 problems are over. He was explaining why he's not going to use lockdown at all. That forget it. It's out of the question. And he said that the full lockdown does not guarantee that the COVID-19 problem is over. So therefore, instead of the lockdown, the government chose to use the emergency restrictions, although I guess we're not calling them emergency restrictions anymore. They're PPKM for. Maybe there'll be a new name on Tuesday. Who knows? President Gowid said that the government chose the emergency PPM because they had to think not only about the health crisis, but also about the problems with the economy. And so they didn't want to shut down the economy completely, and the restrictions, which are pretty lax at this point, allow business to go on just about everywhere. The government and President Gowid are claiming that the emergency restrictions have, in fact, reduced COVID cases on the island of Java. We know that they have it on the island of Bali. And he mentioned the bed occupancy rate at Wisma Atlet in Jakarta was at 1.90%, but it's down to 38% now. And as usual, as with all government people, he appealed to residents, everybody, to be disciplined and comply with the health protocols and wear masks, wash hands, and maintain social distance. And of course, social distance isn't happening. Not here. When I was out today, people crowding around me again when I was in the store. Social distancing is just not in the mindset here. And the president encouraged everybody in Indonesia to take part in the vaccination program so that they could reach 70% by the end of the year. And the president said if it's 70%, at least the transmission of this virus will be somewhat hampered. If it's done, what it's known as communal immunity or herd immunity is achieved, he said. And so with rising case numbers, people are concerned, rightly so. With bed occupancy rates high, in some cases hospitals turning patients away, what's going on? Well, the governor states that Bali COVID situation is under control. The governor came out with an interesting statement this week full of numbers, just to show where we are in the fight to get the virus under control. And that's a good thing for him to come up with the numbers. He assured the community that the increase in cases in Bali can be properly controlled. I'm not going to go over the numbers here because you hear them every week. You can, if you want to see them, you can look at the article, but as I've said before, the numbers change every day. And so taking a look at these numbers from his statement, I think it was on Wednesday, the numbers are already so much different right now. But what are the highlights from the governor's statement? Well, he said, it can be seen that the number of people who are self-isolating at home is very high. This has the potential to transmit COVID-19 to family clusters very quickly, which is a characteristic of the transmission of the Delta variant. Now, he said at the time he was giving this statement, the bed occupancy rate was 78.84% in Bali, and the ICU BOR was 71.28. And he noted in regards to oxygen, the needs have increased dramatically, but because of help from the central government, with the concentrators, there is an adequate supply right now and people don't need to worry about it. He mentioned that Bali has the highest percentage of vaccinations in Indonesia thanks to the central government supplying 4.6 million doses of the needed 6 million in order to reach the 70% or 3 million target. And the plan is to complete this at the end of September. So if you're thinking about coming back before October, yeah, probably not happening. What about the situation with the quarantine, according to the governor? Well, he said the provincial government and the Regency and city governments are implementing a centralized quarantine policy. This is in order to prevent the transmission through family environment. And I've talked about this already many times. The governor said about 40% of infected patients have been vaccinated. So, you get vaccinated, you can still get it. Now, the governor said 40% of the infected patients have been vaccinated. He didn't say if they've been vaccinated once or twice. And 7% of deaths, according to the governor, have been of vaccinated patients. He said that this is evidence that the vaccination is effective in reducing the risk of death for patients. Well, that's 7%. That's really unfortunate that you get that 7% are dying even after being vaccinated. But again, are they vaccinated once or twice? But still, I'll go with the odds. The odds are 93% that I'm not going to die if I catch it. I'm going to get vaccinated. Of course, I'm getting vaccinated anyway. I'm not an anti-vaxxer. And the governor said 63% of the deaths were patients who had comorbidities. Tracing close contacts has been an issue brought up by experts, and the governor said there's been an increase in this of at least 8 contacts for every new case. Okay, so it's getting better. And the governor thanked various departments, agencies, organizations, and individuals that have been instrumental in carrying out the government policy. And he concluded by saying that while the pandemic is ongoing, the community needs to work together to develop patience and collective awareness. Follow the rules. So let's take a look and see what's happening on the streets in Bali. Well, joint teams disbands cockfighting during PPKM in Kayu Putih. Okay, not too far from me, up here in Buleleng. Despite the high number of new cases and deaths, some people in the community are still not taking the situation seriously. This goes for both the foreign and local communities. A patrol consisting of military, police, and other authorities raided a traditional Balinese cockfight in the village of Kayu Putih this past week, on Wednesday. When the team arrived at the location, the gamblers took off and ran, of course. The head of the Buleleng police, Putu Ardawan, said that when they arrived there were only about 20 people still at the location, and he said that he thought that the rest of them probably heard that they were coming and took off earlier, and the 20, I don't know why the 20 stuck around. In addition to violating health protocols by having cockfights, people were not wearing masks, or they were wearing it inappropriately. Pak Putu said that they were doing the chin masking. Also, there was no place to wash hands or measure body temperature. The team took the organizer to the Sukasada sub-district office and gave him an administrative fine of 1 million rupiah and some coaching on how to behave properly. I guess that's what coaching means. And the deputy chair of the Buleleng COVID-19 Handling Task Force, Lieutenant Colonel Lisrianto, said, "We are very disappointed. There are still those who do not comply. We are all trying to prevent and minimize the transmission of COVID-19. Right, we've all got to do our part. Local people and foreigners. Last week I talked about an exodus, a possible exodus of foreigners leaving Bali, and the government denied that there was an exodus. Well, this week, a lot more talk about foreigners leaving. My wife brought up the other day, asked me, why are foreigners leaving Bali? And I said, where did you hear that? She said, it's on TV. I heard a report on TV. Well, here's an article in the Jakarta Post. Foreigners leave Indonesia amid coronavirus case spike. And so according to this article in the Jakarta Post, and I only got to read part of it because it's behind a paywall, so I only saw the first 2 paragraphs. Thousands of foreigners have left Indonesia during the first 3 weeks in July amid the ongoing multi-tiered public activities restriction. And at Soekarno-Hatta International Airport, there were 10,612 foreign nationals leaving Indonesia between July 1st and July 23rd. Sounds like an exodus to me. Japanese and Chinese citizens made up the biggest share with 2,380 and 2,053 respectively, according to a Kompas report. And this was followed by 1,432 South Koreans, 1,251 U.S. citizens, 775 French, 654 British, 625 Russians, 533 Germans, 467 Dutch, and 442 Saudi Arabian citizens. I didn't know we had that many Saudi Arabian citizens here. And today on the Australian Embassy website, there was information for Aussie citizens who want to go home. There was an email address for them to register for repatriation flights. So, despite what the government said about not being an exodus, the facts seem to contradict that. And why are they leaving? Well, they could be leaving because they want to get out on the beach, because they want more time in the restaurants, because they're worried about the hospital occupancy rate, the BOR, the bed occupancy rate, because they want to get vaccinated and they can't get vaccinated here. A number of different reasons, but they are leaving. What about the dine-in restrictions that I mentioned before? Well, Bali Satpol PP admits difficult to supervise dining in 30 minutes. Okay, what about the dine-in 30-minute period? Well, it's been the target of many jokes on social media, many of which are extremely funny. You should take a look at them. I found a lot of them on Facebook and Instagram. I imagine there's some on TikTok as well. So I can see that 30 minutes may work with prepared food from a warung. So let's say you go to a local warung, the food is already there, you get it, you can scarf it up in 30 minutes, no problem. But, or at McD's or KFC, you want to eat in those places, you can get your food quickly and have your meal and be out in 30 minutes. But what about restaurants? Well, the head of the Bali Civil Service Police Unit, Pak Darmani, said that he was having difficulty supervising diners eating on the spot. Why? Well, because his team has limited personnel and there's thousands of restaurants all over Bali, as you know if you've been here. So he's asked for cooperation from business owners to remind their customers to obey the rules. Right, okay. As one business owner said in the article, what we serve is not fast food. If it is sold as fast food, it could be like that. I mean, eat in 30 minutes. In serving food, it takes a long time because the food sold is fresh. Of course, you have to process it before serving. 30 minutes? So, if you have 30 minutes to eat, of course, it's enough, but not if you have to wait for the food to be cooked. So what are you going to do? You could come in, you could order your food, I guess, and you could leave and come back when it's ready, maybe hang out on the beach or on the street, or give them your phone number and have them give you a ring, or you could just sit there and ignore the 30 minutes, which is, my guess is what most people are going to do. So what do you think about this 30 minutes? I'm always careful about what I say here because I'm not a citizen. I'm a permanent resident. I've been here 32 years, but I am not a citizen. And I don't want the government to give me heat about saying something that they can perceive as negative. But 30 minutes? Well, I don't know. Like I said, what do you think about that? So what's happening in Bali? I've talked about several different things, and this is something new. Peduli Lindung vaccine certificate will be a restaurant entrance requirement. What? Oh no. Okay, so let's say you want to visit or stay in Bali. Are you an influencer, a digital nomad, but you don't want to get vaccinated? Well, first, you won't get in the country, and second, you're not going to get into anything else either. Paradise is changing. Sorry. According to the Coordinator Minister for Economy, Arlanga Hartarto, he plans to implement mandatory COVID-19 vaccination rules for visiting public places such as restaurants in the next 2 to 3 weeks. That sounds pretty ambitious. So, you're going to have to be able to prove that you've been vaccinated to get into these places. So you can get a vaccine certificate through the Peduli Lindung application. And in addition to the COVID-19 vaccination data, that application also records data on the corona PCR test and swab antigens as a requirement for intercity travel. And so, yeah, I use it. And so if you haven't used it, you can get it online at the, whatever it's called, the App Store. Minister Arlanga said the government is currently preparing to integrate the Peduli Lindung application with vaccination data from all regions. So this is going to roll out in the next 2 to 3 weeks, he said. But according to this article, the application has only been downloaded by 15 million people. That's out of 270 million, 15 million. So the figure is still far from the total population that's received the vaccination so far, which is more than 48 million. So we got a lot of people that have been vaccinated, but they don't have this application yet. If you've been vaccinated, get the application. So for this reason, the government is telling people to download this application, because in the future the mobility of the population is going to be dependent on your vaccination status. Now, that's as of right now. Today, this is a plan for 2 to 3 weeks from now. You know by now that things change in Indonesia, sometimes day by day. So according to the minister, he said, so of course, with this integration, public places or restaurants should be, when people want to enter, the barcode must be checked, and it can be connected to know that person concerned has been vaccinated or not. So you're going to be able to prove that you've been vaccinated through your app on the phone, and there's going to be the barcode that's going to be checked. Here are ants all over my desk. This is ant season. Okay. So what this plan doesn't cover so far is what's going to be done with the foreigners who have been vaccinated in their home country, or who haven't been vaccinated at all. How are they going to fit into this system? As far as I know, there's been no preparation for those people, the foreigners, vaccinated or not. And so that's going to be an issue, well, particularly since they go to restaurants. And so how are they going to prove that they've been vaccinated? I guess a vaccination passport of some type will be required with a barcode that can be scanned, although what database it would access is another question. Maybe just showing one at the entrance to a tourist destination or a restaurant or a bar will be enough for tourists to gain access. We don't know, but right now the government is not including tourists in this. So there's a lot of logistical and technical issues involved in this plan that were not discussed in the article. I think, and I could very well be wrong, that the minister has some ideas, some solutions for these problems. Maybe he doesn't, though. Will all restaurants need to have technology in hand to do a scan? Even the small, what I call mom and pop restaurants that I prefer to go to. And when exactly is this going to be rolled out? It's in 2 or 3 weeks. Is that reasonable at this point? Are they ready to get everything together for 2 or 3 weeks? And what about people that may not be able to be completely vaccinated until next year? We've got a long way to go in Indonesia in terms of getting everybody vaccinated. Now, if we're just talking about the island of Bali, we've got, 71% and 20%. So we could have a majority of people vaccinated by the end of September. I think that's the plan right now. So a lot of questions about this one. We'll see what happens. For those of you that are here that don't want to be vaccinated, you're going to have a hard time living here if you're not going to be vaccinated. I would think about going somewhere else if you were really an anti-vaxxer, because you're going to need a vaccination proof to do a lot of stuff here in the future. So we've seen that not everybody is following the rules. We've got the cockfighting. Well, next story, next segment. Bali authorities perform a home visit to a couple who refused a COVID test. So this is in Bulaling, of course. So Bulaling authorities visited a couple from Pomeroy village, I'm not sure where that is, after they refused to take a rapid antigen test by a team from the Puskesmas. And the authorities came to the couple's home in order to convince them to take the test, because some of their family members had been confirmed positive, and so they needed to be tested. This is part of the tracing, and good for the government. Now, the couple refused to be tested because they didn't feel any symptoms. And it was noted in the article, the authorities said, they weren't being rude or mad, that they just kind of ignored us and said, no, we don't need it. So the couple runs a small shop, and so there's high potential for them to pass along the virus to a lot of people if they were positive. So the couple were persuaded by the team to take the test, and the results were negative, fortunately. And the head of the military base 1609 Captain Wayanada said that he hoped that people will not be reluctant to be tested in order to help the government with tracing. He said, I quote, "People don't need to worry about taking a COVID-19 test, especially after having close contact with the patients. If they're confirmed positive, they need to undergo isolation in a place that's provided by the government." Okay, and so you got to get everybody following the rules, and of course it's not happening. Okay, it's time for a wrap up. Okay, first off, just let me say, talking to a friend of mine the other day, a very close friend of mine, I've known him for a long time here in Bali, and he said, "Why don't you do 2 a week, because there's just so much happening here. Things are changing on a daily basis." He said, I watch your video every week. I'd like to see it twice a week." And I said, "I've been thinking about that, and I'm going to try this. I'm going to try to do 2 a week, a little shorter than these long ones that I do on Sunday. And so I'm going to try to do one on Wednesday and one on Sunday and see how that works. Because, well, this is going on right now, tonight. But what's going to happen with the extension or the non-extension of the PPKM 4 restrictions, I don't know. And so by the time I get around to talking about it, it's already been done. And my guess is if the president extends this, it's going to be for a week again. So there will be another video on Wednesday evening. We'll see how that works. If you've got any ideas about that, feel free to leave them in the comment section. Okay, so what do we got? We've got the numbers have gone down a little bit nationally, but still saw 1,808 deaths in Bali. Numbers are still up. We're over 1,000. I think it's 8 or 9 days in a row now, and our daily average is up 1,200. Deaths have gone up. We've got 12,000 active cases. Can you believe that? So this is not good here yet. And we're open pretty much. I wasn't aware that the beaches were open. The part of this, I thought the beaches were still restricted. But I saw a video yesterday from some YouTubers that I follow their videos. The monkeys. You can take a look at one of their videos on the beach yesterday in Sinur. They do daily videos kind of wandering around and stuff. And so they were down at the beach. And so beaches are open. And the restaurants are open. Everybody wearing masks? No. Everybody's not wearing masks. Everybody social distancing? No. Everybody's not social distancing. So is that going to help us get any better here? No. We need to, as the president said, and the governor says, and Bupati say, everybody says, wear the mask, social distance, keep clean, wash your hands. Nobody's talking about opening Bali anymore. That's just not on the table. I have not seen an article in Indonesian or English language presses all week. Well, 2 weeks, 3 weeks now. Nobody's really talking about that. Even the head cheerleader for opening Bali, Baksandiaga Uno, I don't see anything from him either. And he was going on constantly about we're going to open June, July, this is going to do this, do that. Well, at this point, that's not happening. You still cannot come into Indonesia unless you have a kitab or kitas or you're a diplomat. So for people that were coming in on the B211, that's not happening. Thank goodness. That needed to be stopped. That's not helping us at all. So are we going to open in August? No, forget it. That's not happening. September maybe. As I've say every week, I'd go with December. I can't see this going on past December, but who knows? We've got the Delta Plus variant here now. So, wow. And this just seems to never end. You take a look at America now. They're going back through a surge in certain parts in Republican-controlled states. They've got a surge going on because people won't get vaccinated and they won't wear masks. So it's important for us here, if we want to get Bali rolling again economically, everybody has to do their part. And that includes the anti-vaxxers that are here. Anti-vaxxers that are Indonesian, the anti-vaxxers that are foreigners. You can't say you love Bali and you support Bali if you're not wearing a mask and you're not getting vaccinated, because you're not helping with the situation. You're causing a problem. So you need to get with the program. And we see this happening in a lot of places now. People that are vaccinated and going along with this are getting irritated, pissed off by people that refuse to, because they're not helping the situation. And what we're seeing is an increase in cases in those places where people are not wearing masks, where are not getting vaccinated. Can you get sick if you are vaccinated? Yes, you can. Likely that you are not going to die, although, as I talked about in a different article, according to the government here, 7% of the people that die in Bali have been vaccinated. But once or twice, I don't know. So that's the wrap-up right now. There's still people not doing what they're supposed to. Indonesians and foreigners both. Everybody has to pull together on this. And in this, I support completely what the president says, the governor says, the Bupati say. Get with the program. Get with the program. Because I'm tired of this, and I'm sure you're tired of this. Living here in this kind of state of limbo. Things are open or they're not open. Nobody knows what's going on. It's frustrating for everybody. And for people whose jobs or income depend on the tourism sector, yeah, it's really bad for that, and that includes a couple of my kids. So, yeah, we have to keep pulling together on this to get through and get over the hump and get open and start to live our lives again. Okay, that's my rant for the day. You can see I'm a little frustrated too about some of these restrictions, that I would love to take the damn mask off. Okay, so I'm going to try upload something on Wednesday, and we'll see what happens. And I'm going to put I'm going to redo the one I did on the governor's plan to continue online education, which really got me going yesterday. So wherever you are, stay safe. Thanks for viewing. Be kind to someone today. See you next time.